Has your business been affected by COVID-19? The Virgin Islands Small Business Development Center is available to assist entrepreneurs and small businesses in the U.S. Virgin Islands. The VISBDC is sustained by the University of the Virgin Islands and the U.S. Small Business Administration and collaborates with local agencies to support the small business community. The VISBDC is nationally accredited and provides free consulting, business education training, and technical assistance. Attend workshops with subject matter experts from both the public and private sector. From idea generation to exit strategies, the staff at the VISBDC is ready to assist you. Now is the time to contact them, so don't wait. Call or email them to find out how they can help your business grow and succeed.
Good morning and welcome everyone. The VISBDC has collaborated with UVI Center for Excellence in Leadership and Learning, UVI Cell, Safety in Paradise component to bring forth this informational webinar to help small businesses become familiar with risk assessments and how it helps lower insurance costs, drive employee morale, and increase revenues. The presenter for today is UVI Cell Safety Specialist, Mrs. Patricia Williams-Anderson. Mrs. Patricia Williams-Anderson is a safety specialist and consultant with the UVI Cell Safety in Paradise and Osha 21D State Consultation Program and has over 25 years of experience working in the safety and health field. Mrs. Anderson started her career in health and safety at the VI Department of Labor in the Division of Occupational Safety and Health, where she performed over 500 safety and health enforcement inspections combined in both the private and public sector to include accident investigations. Her career path has led her to serve as a professional in the safety and health field, where her responsibilities included monitoring and coordinated safety programs, performing environmental health and safety job site audits, and performing coordinated occupational safety trainings. She has a degree in business administration and continues to receive various trainings from the Osha Training Institute, Environmental Protection Agency, the EPA, and the Federal Emergency Management Agency, FEMA, to name a few. Mrs. Williams-Anderson believes workplace health and safety is a culture that must be embraced by both the employer and their employees for it to be successful and beneficial to all stakeholders involved. Just a friendly reminder to put your questions in the chat, and they will be addressed by the presenter either in the chat or later during the question and answer segment. A copy of the presentation is available upon email request to info@visbdc.org. Mrs. Anderson, the floor is yours.
It would work if I unmute myself, right? Hello, and good morning. I am happy you took the time to be here today. You being in attendance tells me you have an interest in workplace safety and health. You care and want to make a difference. Today, I'm going to give you methods you can use to implement or fine-tune workplace safety and health management system. Small businesses in the Virgin Islands are important stakeholders to our economic well-being. One of a business' greatest assets is their employees. Implementing good safety and health management practices, also referred to as SHIM, prevents workplace injuries and illnesses. It improves compliance with laws and regulations and reduce costs, including significant reduction in workers' compensation premiums. And it engaged your workers. Engaged workers boosts employees' morale. Happy employees equals good customer service. And good customer service makes happy and satisfied customers. Happy and satisfied customers allows for the opportunity of customer loyalty and a secure, steady revenue stream. There are 3 methods that I will be presenting on. Once I can get my slide to advance. And they include risk management, Osha record keeping of workplace injuries and illness forms, workers' compensation, insurance, and developing and implementing a safety and health program. So risk management is a pivotal method employers can implement that helps to effectively navigate hazards in the workplace. Knowing the hazards or inherent hazards associated with the type of business you own or manage is important, and have an inside knowledge of the hazards, and having an inside knowledge of the hazards can help you plan how to mitigate and bounce back when the events occurs. The OSHA record keeping forms is a tool key in identifying trends negatively impacting in workplace. And then having asset liability to include employee liability insurance helps with building a sustainable capacity to a resilient business, and it's the law. Developing and implementing safety and health management programs or systems is like creating a contingency plan to address all hazards. It is simply a good business practice to sustainability. I'll go through the what and how of these methods. Method 1, risk assessment. It's a systemic process of identifying hazards and evaluating any associated risk within a workplace, and then implementing reasonable controls to remove or reduce them. Knowing the hazards in your business gives you a better understanding of what your employee needs are for them to perform their tasks safely. Remember, employees' well-being will ultimately have a direct impact on your customers' experience. Why not proactively invest in creating a safety and health culture? Risk assessment and identifying your hazards associated within your industry. You would look into what hazard your employees could potentially be exposed to, what hazards or risks are identified with the facility, and then are there any hazards associated with how the service is provided? So we identify that we need to identify our hazards. We will define what hazards are. And hazards are anything that has the potential to cause harm to people, damage to property, or loss to process. We may not be able to clearly see all the hazards in this photo, but there are many. So to point out a few, I've circled a few of them. That's a floor hole the lady is about to walk into. We have water on the floor. The footing for the ladder is unstable. And the cords throughout the floor, posing a trip hazard. The point is, there are working conditions that have the potential to either cause harm to people, damage property, and the incidents and accidents are lost time to services and production process. Risk assessment you're identifying hazards. And hazards are found in either the process or the task an employee is performing, in that they can be performing the procedure in a wrong way or taking wrong actions to address issues. Sometimes when employees don't have are not giving clear instructions, they improvise with techniques they think are best, which may lead to hazards. In equipment, the hazards can be found in defective equipment or inadequate tools. Some questions you may want to ask in investigating whether equipment have hazards is, what tools are necessary when using the equipment? Selecting the wrong materials or chemicals or using them improperly can have serious or deadly consequences. Hazards can be caused in the environment and are such situations as poor lighting, inadequate ventilation, poor housekeeping, slippery surfaces, and noise. And lastly, hazards caused by process may be a result of the combination of the previously mentioned triggers due to the flow of work or as a byproduct of the hazards. In identifying hazards, you can begin to analyze the best control measures. Control measures give insights and is ideally done in the planning, design, and preparation phase of a task or process. So that's where you have the before exposure to hazard incident. During exposure can be found in situations of near misses, minor or uneventful incidents. And after the exposure to a hazard, there is much information that can be gathered. The main focus should be on reviewing the task or process leading to the event and not on casting blame. Risk assessment systems are the proactive way of working healthy and safely. So to summarize on risk assessment, we'll ask the question of, why is risk assessment important? Risk assessment is important. It's necessary. It's a necessary component of a successful safety and health program. It creates awareness to hazards and risks and allows the opportunity to implement effective control measures. Who should be involved in risk assessments? Everyone. Employers, to include executive, president, managers, supervisors, the employees, and employee representatives, if there are any. Are there any questions so far? Okay, I'll just go on. Method 2. Method 2 is a combination of information. Business owners are encouraged to maintain the Osha workplace injury and illness record keeping forms and obtain workers' compensation insurance. It's the law. Maintaining the Osha forms and obtaining employee insurance are business practices that can help a business see where they're losing revenues and identify ways to address negatively impacting conditions. So here's what you need to know. OSHA Code of Federal Regulation, CFR, Title 29, Section 1904, is the OSHA injury and illness record keeping requirements. It is nationally required throughout the US and its territories, and is applied consistently regardless to location. The Virgin Islands Code, Title 24, Chapter 11, covers the mandate for employers to have workers' compensation insurance. I'll begin with going over the injury and illness record keeping requirements. The OSHA record keeping information is important. When recorded and maintained accurately, it helps employers and managers identify potential areas of concerns and trends. It is also a tool that can be used to keep track of an organization's safety and health management system. OSHA uses the information to evaluate data and keep a pulse on workplace safety, understand industry hazards, and it allows OSHA to have an informed, data-driven mechanism to implement standards aimed at protecting workers or eliminating hazards. Some incidents go unrecorded because there is a belief that an incident happened due to outright negligence. At times, employers fail to log incidents because they fear negative implications, or employees neglect to notify their employers of incidents for fear of retribution. Please understand that not every injury or illness is due to an employer's negligence, nor is it always the employee's fault. Have a system in place that allows for employees to inform management of incidents. OSHA has a program on its website called the OSHA Safety Pay Program. This program uses a company's profit margin, the average of costs of an injury or illness, and an indirect cost multiplier to project the amount of sales a company would need to cover those costs. The program is intended to raise awareness of how occupational safety and health illnesses can impact a company's profitability, but it does not provide detailed analysis of a particular company's injury and illness costs. The link will be provided in information that will be sent out to attendees after the presentation. So who is required to maintain the OSHA record keeping forms? Many employers are required. However, there are a few exemptions. These exemptions include employers with fewer than 10 employees throughout a calendar year, and employers in low hazard industry businesses within a specified NAICS code. That's a North American Industrial Classification System code. If you employ 10 or more employees at any time during a calendar year, you're required to maintain record keeping forms. Employees includes full-time, part-time, temporary, and seasonal workers. In addition, if your company has more than one site location and your total count of employees is 10 or more, regardless to the count at each location, you are required to maintain forms, and those forms are required to be site-specific for each location. Corporate offices can be the main office where the information is kept, but once the information is requested, once OSHA requests the forms, it needs to be provided within 4 hours of the request, or an employer can be cited. So there's an extensive list of NAICS codes for partially exempt industries, and that is also provided on the OSHA website. What is required to be reported? All employers, including those exempt, are required to report workplace incidents of fatalities, inpatient hospitalization of one or more employees, amputation, and eye loss. Fatalities are required to be reported to OSHA within 8 hours of occurrence. Lastly, incidents involving inpatient hospitalization, amputation, and eye loss must be reported within 24 hours. I've provided the numbers for the local office, our regional office, and then the toll-free number also provided is the website where you can report fatalities, inpatient hospitalization, amputation, or loss of eye incidents. If they're not reported and you experience an OSHA inspection and it's identify that there was an incident, you can be cited. OSHA's penalty has increased tremendously. So what to record? Any work-related injury or illness that meets certain severity criteria must be entered on the forms within 7 calendar days of its occurrence. OSHA defines an injury or illness as an abnormal condition or disorder. Injuries and illnesses includes any work-related fatality, injury and illness that results in loss of consciousness, days away from work, restricted work, or transfer to another job, and any injury or illness requiring medical treatment beyond first aid. COVID-19 instances have to be recorded when they meet the definition of a work-related injury. And there are 3 elements in identifying. The first element is it has to be identified as a confirmed case of COVID-19 as defined by CDC. The case has to be work-related. And the last and third element is the case involves one or more of the general recording criteria. So now we have an overview. We'll have an overview of what the forms look like. The forms consist of a OSHA 300 log, 300A, summary of work-related injuries and illness, and the 301, the incident report. The first form here, shown here, is your 300 log. This log must be completed for every recordable work-related injury and illness. Again, it must be reported within 7 days of its occurrence. And the reason why I'm repeating that is because if OSHA enforcement comes in and they audit your files or your logs and they notice that the incidents are not recorded in sequential date or in date order, and they're out of order, you can get cited for that. Please make sure to maintain the log throughout the year and review the information to verify the entries are complete and accurate. This form needs to be completed at the end of the year. And if there are no injuries or illness, you must enter zeros because the information, the totals on this page is then transferred to the next form, the OSHA 300A, which is the summary. The summary is on the left side of the summary is the totals, like I said, that comes off, is transferred from your log. And the left side, the right side of the form. So this is the left side, the right side. This is the left side where the totals are transferred. And on your right side is the employer's establishment information. This is where the address, the NAICS code, your average number of employee number, and the hours is entered. Also on this form, not shown here, is a very important information on where the document needs to be signed by a company official. So when OSHA says have a company official sign this document, it is either president, management in office of corporate, or the highest ranking company official. And the rationale with having company official sign the document is, if you have to sign the document, then you're looking at the information that's provided. And if you have numbers in where you have injuries and illness, it should prompt management or the official to ask, what's going on here, if they don't know, and start to assess why are we having injuries? Why are we having illnesses? What can we do different to minimize this potential? The last form is the 301, which is the incident report form. And this form must be filled out for every recorded incident on the 300 log. So as you make your entry on the 300 log, please create an incident report for that entry. And both forms should be completed within 7 calendar days of an injury or illness occurrence. I'm repeating that information because it's very important. So the information contained on the 300 and the 301 incident report forms can help the employer develop a picture of hazard trends to the extent and severity of what injuries or incidents are occurring on the job. It also helps OSHA to get a bird's eye view of what's going on within your organization. Now let's go over posting requirements. A copy of the annual summary must be posted in each establishment where notices are normally posted for employees. You must post the summary between February 1st and April 30th. If you choose to keep the information posted throughout the year, that can help to serve as a reminder to maintain the information, and it would give readily accessibility to OSHA or employees to have accessibility to the information. So employees, former employees, their representatives, and OSHA officials have a right to see the record-keeping forms. Do note that both the 300 and the 301 incident report include confidential information relating to an employee's health, and therefore can only be shared and used in a manner that protects confidentiality to the extent possible. Do not send information to OSHA unless you're asked to do so, but please do keep your records on file because OSHA can ask for up to 5 years of records. So employers, Record and maintain your OSHA record-keeping forms. It's a good business practice that would help to give insight and control information, loss control information. There are some employers who are required to submit their injury and illness information electronically. And they do so through the injury tracking application, ITA, which is accessible on OSHA's website. Only a small fraction is required to submit their forms electronically. And it normally would be employers with 250 or more employees, or employers with between 20 and 240 employees in a classified specific industry. So if you're required to electronically submit your injury and illness information, it's required to be done by March 2nd. If you miss the March 2nd date, you can still enter the information up to December 31st. However, do note, they can or they will be able to see when you entered the information. So try and be on time. I would recommend that once you've completed your form and posted it in February, to immediately electronically submit your information. So you'll be ahead of the March 2nd date, but you won't forget. So just to summarize, OSHA's record-keeping requirements. Employers with 10 or more employees are required to keep the forms. All employers is required to report fatalities within 8 hours, inpatient hospitalization, amputation and eye loss incidents within 24 hours, log your recordable incidents within 7 days, at least 7 days of its occurrence. The OSHA 300A summary must be signed by a company official, and the summary must be posted between February 1st and April 30th. If you're electronically required to submit your information, do so by March 2nd. Sharika, are there any questions?
None at this time. You can proceed.
Thank you.
You're welcome.
Now we'll branch off to an equally important topic, workers' compensation insurance. Most businesses normally secures business property, vehicle, even general liability insurance on a regular basis, but tend to lag with securing employee liability insurance. Please do obtain workers' compensation insurance. It's the law. The law requires all employers who employ one or more employees to have workers' compensation insurance. So in order to secure workers' compensation insurance, businesses must contact the Department of Finance Government Insurance Office. The professionals at the Government Insurance Office can be contacted at the number and the information provided here. Their website also has information on how to proceed with securing workers' compensation insurance. We'll go into method 3. Method 3 The main goal is to prevent, method 3, is the development of safety and health program or system. This will help to prevent workplace injuries and illnesses, deaths, and as well as the suffering and financial hardship these events can cause for workers, their family, and employers. A safety and health management system, also referred to as SHIMS, is a proactive approach to managing workplace safety and health. Traditional approaches are often reactive. That is, problems are addressed only after a worker is injured or becomes sick, or a new standard or regulation is published, or you experience an outside event such as maybe an inspection from Osha and problems are identified or found. A SHIMS recommended practice recognizes that finding and fixing hazards before they cause injury or illness is far more an effective approach. So there are 7 elements at the core of developing a sound and stable safety and health system. And they include the need for management leadership, workers' participation, hazard identification and assessment, hazard prevention and control, education and training, program evaluation and improvement, and of course, communication and coordination. And I'll briefly touch on each element. In element 1, management leadership, this is where vision and resources, leadership, vision, and resources is needed to effectively implement your safety and health program. Management leadership includes business owners, managers, supervisors, and they all have to buy into and be vested into the safety and health program. And they can do so by making workers' safety and health a core organizational value. Make it their culture. Management leadership needs to be fully committed to eliminating hazards, protecting workers, and continuously improving workplace safety and health as the defined goal for the program. When they visibly demonstrate and communicate their commitment to workers, it allows the opportunity for workers buy-in. Set an example through your own actions. This means the employer is not just talking the talk, but they're walking the walk. I believe if every manager or leader would be the model employee they expect their employees to be, then their staff would have no choice but to follow suit. Managers set the tone. Element 2 speaks to workers' participation. So workplace safety and health is a shared responsibility between the employer and its employees. And to be effective, employees' participation is encouraged and necessary. When we encourage workers to participate, we engage them. We engage them by getting their input and giving them the opportunity of providing information in all phases of the program, in the program design and in the implementation. Allow the employees and their representatives to have access to information needed for them to participate effectively. Remove barriers to participation by not being retaliatory when the employees or their rep raise safety and health concerns, or if they report injuries and illness hazards, or participate in a program or exercise their safety and health rights. Employees' rights have a right provided through Osha to have a workplace that is free from recognizable safety and health hazards. They also have rights through the National Labor Relations Act. Element 3 speaks to hazard identification and assessment. I went over risk assessment in the beginning. And so as you can see, this is an element, it's very key in your safety and health program or system. So the takeaway on hazard identification and assessment is all proactive and effective safety and health programs requires employers and the workers to identify and assess hazards by collecting and reviewing information on hazards present or likely to occur in a workplace. By conducting workplace inspections to identify new or reoccurring hazards. Investigate injuries and illness incidents, close call, near misses, to determine the underlying hazards, their causes, and the safety and health program shortcomings. We want to also identify hazards associated with emergency and non-routine situations, which can be obtained from information on the OSHA 300 forms. And then characterize the nature of the hazards found and identify interim controls to minimize the potential risks. Element 4 speaks to hazard prevention and control. Effective controls protect workers from hazards. As you can see, the hierarchy of controls indicates the most effective means and the least effective means of controlling hazards. And the most effective means is to engineer a hazard out, physically remove it. And the least is personal protective equipment, PPE. So to effectively control and prevent hazards, employers should identify what are the best control options available, and do so by involving workers who often have the best understanding of the conditions and insight on how they can be controlled. You want to select controls by identifying and evaluating options using the hierarchy controls. You select controls to protect workers during non-routine operations and emergency by using a hazard control plan guide. And then you want to follow up to confirm controls are actually effective. And by evaluating the effectiveness of the controls, you would have a picture of where your safety and health program or system is. Element 5 speaks to education and training. Education and training are very important tools used for informing workers and managers about workplace hazards and their controls. It gives them an opportunity to gain a greater understanding of the organization's safety and health program. This will allow meaningful engagement and the ability to contribute in the development and implementation of your safety and health program or system. Provide program awareness training to executives, managers, supervisors, your employees. You train your management staff and your employees on their specific roles with the knowledge and skills needed to do their work safely, so that they would be able to identify and also be able to identify how to avoid creating hazards that can place themselves or others at risk. Element 6 speaks to program evaluation and improvements. Once a safety and health program is established, it should be evaluated initially to verify it has been implemented as intended. A written program, any written program, is only as good as its actual implementation. Employers should monitor performance and progress by establishing, reporting, and tracking goals that measures the program's progress. You should provide ways for employees to participate in the evaluation and implementation process. Remember, your employees are your first liners. Sometimes they think ways to address hazards. Sometimes they have to do it spontaneously because they're the ones that's actually performing the duty. So it would be best to always involve your employees in the process of your management safety program. And then you want to correct the program shortcomings whenever assessments identify opportunities to improve. And this should also include or have the input of all level employees. Sharing the results of monitoring and evaluation and celebrating successes will help to drive further improvement and build employee morale. So the seventh and last element speaks to communication and coordination. In the US Virgin Islands, most of the services provided are by small business owners. Communication and coordination is a potential potential hazards on a job site is necessary to achieve efficiency and effectiveness. Pre-planning needs to be integrated into the planning phase and continuously throughout the cycle of the service to ensure adequate information is being disseminated to all shareholders. Establishing and implementing procedures that it ensures the exchange of information about hazards and the control measures to all potential speaks to all potentially exposed speaks volume to an employer's intent. Coordinate by planning, scheduling, and resolving identified issues, and then working out the concerns or conflicts that may impact the well-being of all shareholders. So some of the information required to have meaningful communication and coordination is knowing the hazards that may be presented or arise from the work being done. And then having a procedure or measure implemented to control these hazards, either by engineering them out, having administrative controls, or PPE. And then having a system that allows the opportunity for one to know who to contact and how to report injuries or illness incidents if one should occur. That was a lot of information. I've reached the end of my presentation. Are there any questions at this point, Sharika? Okay. I know, like I said, this was a lot of information, but I hope it was enlightening. We are 27 days into 2022. The past 2 years have been trying, but should have provoked an awareness of the need to be creative. Be proactive by conducting risk assessments of your business. Complete your Osha work-related injury and illness forms, as the information will be very valuable to addressing hazards and cutting costs associated with injuries and illnesses. Obtain your workers' compensation insurance. It is the law. And develop a safety and health management system or program that works as a contingency plan to all potential hazards your organization may face. If you need assistance with identifying hazards or even creating your SHIMS program, please contact the Safety in Paradise OSHA consultation program. The information is, the services is provided free of charge to small businesses, nonprofit organizations, and employers with 200, 250 employees, or corporations with no more than 500 employees. Your participation is voluntary. All you need to do is submit a request for services. However, the employer has to have a commitment to improving safety and health in the workplace and correct any conditions pointed out during the visit. My name, my contact information is provided here. If there are any questions?
There aren't any questions in the chat, but I'll take this time to say that the VISBDC has so much in store for the USVI small business community. We want to encourage persons to visit our website at www.visbdc.org. Download the VISBDC app on your mobile device from the appropriate app store. Like and follow us on Facebook, Instagram, Twitter, Google My Business, and subscribe to the VISBDC YouTube channel for new uploads of our on-demand webinars. This webinar will be accessible from that platform, and we want to encourage persons to take the survey for attending this webinar. So we'll go ahead and place that link in the chat while we wait for questions. So we want persons in the audience to go ahead and initiate that survey. There's the link in the chat. You can go ahead and begin. And while we keep the floor open for any questions that may be typed, I just want to let everyone know of our upcoming webinars. On February 1st, we have SBA Webinar Tuesdays at 11 a.m. That webinar is entitled Resources to Help Your Business Start, Grow, and Succeed. Also on the 1st at 7 p.m., we're collaborating with SCORE, and that webinar is called Branding 101. February 3rd at 11 a.m., we have Business Financing in the USVI Startup Popular Program. February 9th at 10 a.m., we have Tax Basics for Farmers, Fishers, and Other Small Businesses by the IRB. On February 10th at 11 a.m., we have the USVI EDA, Economic Development Bank sector, presenting on microcredit and intermediary relending loan programs. And so I don't see any questions in the chat, Mrs. Anderson. So I'm going to go ahead and close. And we want to thank you for your time on behalf of the entire VI SBDC network and UVI Cell Safety in Paradise. Bye, everyone, and have a great day.
Thank you for attending.